So today we're going to be talking about different stimulants in this psych setting and discuss the pros of some of them, the cons of some of them, and also the extremity of what can happen when you go into full-blown psychosis, in particular with meth psychosis. So sit back, relax, and I'm going to be going everywhere when it goes to when we're talking about stimulants today. So just try to follow me as I go. I have ADD myself. Let's jump right on into it. Please like and subscribe to the channel. This is all, the stuff I'm talking about is all in regards to experiences I've had or medications I've taken in my past. Love you all. So first, let's look at some of the pros of stimulants in the psych setting. For example, for somebody with ADD or ADHD, or even, for example, narcolepsy, where you fall asleep behind the wheel, there are specific medications that can help. So this would be a pro when it comes to stimulants. There are meds like Adderall, which would be Adderall IR or ER, instant release, extended release. There's also Vyvanse. Vyvanse is another popular medication. It's an extended release stimulant. And typically the doses it would come in would be anywhere from 30 to 40 to 70. 70 would be the highest dose. Typically with Adderall IR, it's anywhere from 10 milligrams to 20 to even 30 twice a day typically. And also Ritalin. Ritalin would be another one. But the whole point of me mentioning these is today a lot of times I think there's a stigma related to if somebody has ADD or ADHD and they're taking a controlled substance like Adderall. Sometimes I've seen people jump to conclusions thinking, oh, they're a drug seeker because they're taking Adderall. Well, you know, the reality is in my past, I took Adderall, okay? I to this day have ADD. I do. Now, do I today? No. However, I will say this. When it comes to these types of medications, can they lead to problems down the line if not prescribed for the right reason, like you lie about a diagnosis or a doctor just gives it to you to give it to you because you say it? Yes, that could be a problem, because if you have a history of addictions or family addictions, that could definitely play a part in you leading to the con types of stimulants. But to wrap up with the stimulants that have pros, they do have side effects, all these that I just mentioned, but I will say I've seen them work miracles for people who have ADD, ADHD. So I just want to clarify that. For example, amphetamines are not the same thing as methamphetamine, which is the next thing I'm leading into, which would be this would be a bad stimulant or a stimulant that has cons. Now you might be saying, well, meth, obviously. Well, when it comes to how amphetamines, for example, Adderall, Vyvanse, Ritalin, how they actually attach to the brain are fairly similar to something like a methamphetamine. What stimulants do is it essentially hits your dopamine receptors and releases dopamine rushes. Sorry, not massive. It does release massive for methamphetamine, but for your prescribed stimulants, nothing like it. They both, methamphetamines and meth and amphetamines, do essentially affect your dopamine. Now, somebody who has ADHD or ADD, a lot of times who can't pay attention, they need that dopamine to be able to think that. And I know a lot of times there's been debate on, oh, you can't show, how do you know what really ADD is or ADHD is when you can't actually image it? There's no way of actually showing it. Well, I'll be honest, working in the psych setting, I've seen plenty of people who had severe ADHD or ADD and then were prescribed that medication, a stimulant, and it worked miracles for them. Now, once again, methamphetamines now. So it is a huge hit of dopamine, and it destroys your dopamine receptors in your brain. When you have a dopamine hit like that, in particular, not smoking it obviously, but if you're shooting methamphetamine, you are ruining your dopamine receptors, truthfully. Because when you're shooting, a lot of them can't be repaired. I'm not saying there are people who can't recover when shooting up. You can if you have the willpower. But chances of success go down tremendously when you're shooting meth, unfortunately. And here's the thing, I know people who have actually been successful, so I'm not trying to trying to say you can't. Just realize that right now, if you are smoking it and you feel like it's not doing the job for you, shooting it is not going to do you any favors. It's just not going to. Now, real quick, if you are, real quick, getting off of meth, or you're trying to find things to help you cope while you go through the detox, there are actually medications that can help. There's something called Strattera that helps with ADD or ADHD, and this can even help with somebody getting off of Adderall and whatnot. It doesn't attack your dopamine receptors. It's more of a, it's a med that kind of, in a way, I'm trying to think of the word for it. It doesn't really attach to your it doesn't affect your dopamine levels, but it does help you increase cognition. I will say that. So Strattera is good for methamphetamines or amphetamines. B vitamins, I've mentioned in the past, you need to make sure you're keeping up with your B vitamins when going through detox from meth in particular, because there's a high chance they're deficient, because a lot of times people who are using meth do not sleep for days. So they're deficient in a lot of different things. Wellbutrin is a medication. Wellbutrin and antidepressants are meds that can be used down the line. They wouldn't be used for the first couple weeks of physical withdrawal. They would be something that you would use, honestly, depending on how much you were using, the severity of it, would be anywhere from 3 weeks down the line to multiple months down the line. And this is, once again, I'm talking from an RN perspective, from what I've seen and some experiences I've had myself, and experiences with patients on what they've told me has helped them overcome, in particular, meth addiction. The reason why I talked about amphetamines first off as well was just to clear up the fact that they're not the same thing, and a lot of people for some reason think they are. Also real quick, what I was going to say about Strattera, it has a psychotropic effect, which I won't go into detail for what that is, but that is what helps with cognition and inhibition, and it can help with sex drive as well. And also, sometimes a low dose of like a 0.5 Ativan for somebody who's really, struggling during this time when they're first going through it, because your anxiety when going through meth withdrawal it's very tough. Very, very tough. With amphetamines, a lot of times if you're getting off of it the right way, you'll be tapered off slowly to like 10 to 5 milligrams. So when you get off, it'll still be tough, but it will not be near what it could be than going cold turkey off it. So the best way to get off of amphetamines is tapering. And I would say this, even with meth, for example, if an addict could, but a lot of times it's too late and they either get caught, go to jail, something happens. If you are shooting meth right now, I have read and you're trying to quit, a way that would make it a little easier, and from what a patient told me, was he was shooting it, he didn't have veins anymore, and he had, for example, he has hep C, he had a necrotic arm, lost his leg, shot in his feet. He was done with it, he went from that back to smoking it, he went from that to using it rectally, to smoking it, and tapering off it, and got off of it. But once again, a lot of people would not do that, but I've heard of that working. And lastly, real quick, y'all, please like and subscribe. I greatly appreciate it. And hit that bell icon as well. Lastly, with methamphetamines, what happens in the psych setting when we see them when they come in? A lot of times they're in meth or even crack psychosis. It hits the same receptors as well, the dopamine, but it can be quite the experience to see somebody in meth psychosis where they haven't slept in 5 or 6 days. They don't know where they are. They don't know who they are. They think they're out of their body. They think they're having an out-of-body experience. They think they can go through, they literally think they can go through walls, but that's more so with PCP a lot of times. More of a PCP thing. But I will say the paranoia, anxiety, just they're like just scratching skin, you know, and then any eye contact with them. Like, if I know a lot of times I've seen examples where patients look at somebody who's in it and who's in, you know, meth psychosis, and they stare at them and then they get attacked. You know, it's something that's very scary to see. And really the thing that helps when they're in that state, if you have a loved one that's in that state, is to try to get them to a psych hospital, because what they need is sleep. You know, and at the end of the day, you taking them there will not get them clean, but they're gonna be the ones that have to make the decision. But sometimes situations like that, you know, if they're going 5 or 6 days without sleep, I mean, they could seriously hurt themselves. I mean, with that, I mean, 5 or 6 days no sleep, paranoia, no eating, no nothing, not even taking in water, you know, it's tough. But a lot of times in the psych setting, what we'll end up giving is a B52, which I talked about in the last video, Benadryl, Haldol, and Ativan. That typically helps, you know, with at least putting them to sleep. They'll sleep for a while. And in that situation, a shot would be justified if they're being aggressive, they're not sleeping, and they're a threat to themselves, keyword. But I just wanted to make that video, all things stimulants. From Adderall to methamphetamines, they're not the same thing. Amphetamines and methamphetamines are not the same thing. There are huge differences. They do work the same way on the brain, just not the meth works in a more powerful way on the brain with the dopamine, remember that. But I just wanted to throw that video out there. I'm gonna throw videos out like this a lot right now. I'm also gonna drop a video next about just straight up about PCP, angel dust. I love you all. Have a great Tuesday tomorrow. Peace and love. Like and subscribe. This is your daily dose of mental health with Adam. Ch-ch-chia.